I have some breaking news for you today.
Breaking news.
Medicare is going to get more expensive in 2025. That's right. The Centers for Medicare and Medicaid Services, also known as CMS, just released the Part B premiums for 2025. They also released the copays that you'll pay for Medicare covered services, as well as other costs. And in addition to that, Social Security has released how much your Social Security check is going to go up next year. Aside from that, there are also huge changes coming to Medicare Advantage plans, as well as Medicare Part D prescription drug plans.
Keep calm, keep calm.
Now, all of these changes will affect everybody on Medicare and Social Security. So pay close attention because I'm going to go over the 5 biggest changes that are coming next year that you need to be aware of. Let's start with the changes to Medicare Part A. So just as a quick refresher, Medicare Part A covers your inpatient hospital stays, which we usually call hospitalization. Now, when you're admitted to the hospital, Medicare Part A generally is the part of Medicare that'll cover your stay. Aside from that, Medicare Part A sometimes also covers skilled nursing facility stays and hospice care. So with that said, let's take a look at the numbers. All right, starting with the premium. In 2024, most people have a $0 premium for Medicare Part A, meaning they won't pay monthly to have Medicare Part A. Now, generally speaking, if you've been paying Medicare taxes for 40 quarters, which equates to 10 years, you should not have to pay a premium for Medicare Part A. That means that in 2025, Medicare Part A will still be 0 premium for most people. However, the deductible, which is the amount that you have to pay out of pocket before Medicare Part A starts covering you in a hospital stay, was $1,632 in 2024. But in 2025, it is going up slightly to $1,676. This means that you're going to have to spend a little bit more out of pocket next year before your Medicare Part A coverage kicks in. It may sound like that's not a huge increase, but keep in mind that 10 years ago, in 2014, it was only $1,216. So it has gone up $460 over the past 10 years. This means that you're going to have to spend a little bit more out of pocket next year before your Medicare Part A coverage kicks in and covers you in the hospital. Let's move on to hospital copays. Once you've met your Part A deductible, Medicare Part A will typically cover 100% of the first 60 days in the hospital. However, once you reach day 61, you start to pay a daily copay. And in 2024, the amount that you would have to pay daily for days 61 to 90 was set at $408 a day. Now, after days 90, you could be responsible for paying 100% of the bill unless you have some lifetime reserve days with Medicare, because Medicare Part A has something called lifetime reserve days, and you get 60 of these lifetime reserve days. If you use all 60 of them, then the next time you're in the hospital, your coverage stops at days 90. But if you still have 60 lifetime reserve days, then you could go as far as 150 days in the hospital. But days 91 through 150, or in other words, the 60 lifetime reserve days, those have a cost which is much higher. And in 2024, you would have to pay $816 a day for using one of your lifetime reserve days. But as a reminder, once you use up your 60 lifetime reserve days, you have to pay 100% of the bill in the hospital. So that's one of the reasons why it's really important to consider what coverage you have with your Medicare. Now, let's take a look at how these numbers are changing in 2025. In 2025, from days 1 through 60, you still don't have any copays, so that's good. Again, once you've met your deductible, Medicare Part A will cover your first 60 days at the hospital at 100%. However, in 2025, when you go from days 61 to 90, you will have a copay of $419 a day. So that's something that's also going up. Now, for reference, that was only $304 in 2014, just 10 years ago. Now, from days 91 to 150, which are your lifetime reserve days, the daily copay is going up from $816 in 2024 to $838 in 2025. And then, of course, once you reach day 150, or whenever you've run out of lifetime reserve days, you will then have to pay 100% of your costs for a hospital stay. Now, finally, with Part A, we have the skilled nursing facility copays. In 2024, your first 20 days in a skilled nursing facility, they were 100% covered by Medicare Part A. But from days 21 to day 100, you had to pay $204 copay every day. And after that, when you got to day 100, you were responsible for 100% of the bill for being in skilled nursing. Well, in 2025, you will get the same format. Medicare Part A still covers the first 20 days at 100% when you're in skilled nursing, but instead of having a $204 a day copay for days 21 through 100, that is increasing to $209.50 a day. That's right, $209.50. Apparently Medicare really needed that extra 50 cents. They couldn't just make it a nice round number at $209. Of course, once you reach 100 days in skilled nursing, the same in 2025 as it was in 2024, you will be responsible for 100% of the costs of skilled nursing. So those are the changes to Medicare Part A in 2025. Up next, let's go over the changes to Medicare Part B. Medicare Part B covers your outpatient medical needs. So in a nutshell, Medicare Part A is covering your hospital stays, and Medicare Part B is covering all of your other medical needs except for prescriptions that you order at a pharmacy. So let's take a look at the numbers for Medicare Part B. Unlike Medicare Part A, most people typically need to pay a premium for Medicare Part B. And in 2024, the base premium was $174.70 a month. And that's what most people were paying. That adds up to $2,096.40 a year. Now remember, this is the base premium. If you have very low income, then you might not be paying that premium. You might have a zero premium for Medicare Part B. But if you have a high income and you're in one of the higher income brackets, you usually will have to pay an additional surcharge on this premium. And the surcharge is known as Medicare's Income-Related Monthly Adjustment Amount, or IRMAA for short. And I'll talk to you more about this in a bit, but in 2025, the base premium for Medicare Part B is going up to $185 a month, which adds up to $2,220 per year. This means that next year, most people will spend $123.60 more just to keep their Medicare Part B. As you can see, Medicare will also be feeling the impact of inflation next year. But speaking of inflation, the good news is that if you're taking Social Security, your benefits are also going up next year, so that helps with the increased premium. The bad news is that this increased premium is taking away some of the money that you receive from Social Security. I'll talk about that more in a minute, but first let's look at the deductible for Medicare Part B. In 2024, the deductible was $240 for Medicare Part B. Again, this is the amount that you would have to spend out of pocket before Medicare Part B starts covering you. In 2025, the deductible is going up to $257. So that's a $17 increase in the coming year. To give you perspective on how this is changing over time, 10 years ago, in 2014, the Part B deductible was only $147, so it has increased by $110 in the past 10 years. Now finally, there's the coinsurance that you get for covered services, which is staying the same in 2025. In both 2025 and 2024, it's 20% out of pocket for most covered services under Medicare Part B. But okay, let's circle back to the premium and talk a bit about the Income-Related Monthly Adjustment Amount, or IRMAA surcharge. Here's a quick look at the IRMAA brackets for 2024. The numbers on the chart are taken from your Modified Adjusted Gross Income, or MAGI, that's on your tax return from 2 years prior. So the number for the 2024 IRMAA were taken from the 2022 tax return. And as you can see here, if your individual tax return has an MAGI of $103,000 or below, you pay the base Medicare Part B premium. If your MAGI in your joint tax return is $206,000 or below, then again you pay the Medicare Part B base premium. You can also see that the more that you make, the higher your Medicare Part B premium surcharge will be. That's the 2024 numbers, and in 2025, here's how things are going to look. Now remember, these numbers are taken from your tax return 2 years prior, so for 2025, these numbers will come from your 2023 tax return. And for individuals, the most you could have made in 2023 before moving to the new IRMAA bracket is $106,000, while for couples, the number is $212,000. Now, if you move up to the next income bracket, you'll pay an additional $74 for your Part B premium in 2025. And you can see that as your income increases, then your surcharge also increases. Now, if this is too much for you, maybe you're not making as much money as you were 2 years ago, you could contest your IRMAA bracket. I'm not going to go into the details here, but generally speaking, there are 8 life-changing events that allow you to contest your IRMAA bracket and use your current income instead of your income from 2 years ago. And these life-changing events include things like marriage, divorce, retirement, loss of income, and a few other things. So that's how the IRMAA brackets look for 2025. Before I move on, let me just jump in here and say that if you're finding this video helpful, please leave a like. This not only supports our channel, but it also helps this video reach other people who need to know about these changes for 2025. All right, let's get back to the video. Now that we've looked at the changes to Medicare's Part A and B, which are known as Original Medicare, let's go deeper and look at the changes to the private insurance side of Medicare. Medicare Part C is also known as Medicare Advantage, and Medicare Part D is known as prescription drug plans. They are having some major changes next year as well. So let's go over these changes, starting with the Medicare Advantage plans. In 2025, CMS introduced unprecedented regulations for Medicare Advantage plans. They're a lot stricter with these plans, plus they did not increase their funding to match inflation, which a lot of insurance companies were not happy about. As a result, many Medicare Advantage plans are either raising their premiums or cutting down some of their benefits, or in some cases, closing their plans altogether. The changes coming in 2025 are unlike anything that we've seen in previous years on Medicare Advantage. That's why if you're on a Medicare Advantage plan, it's critical that you review your annual Notice of Changes document, or ANOC as we like to call it. This document goes over all of your plan's changes for the coming year, including changes to your plan's premium, your network of doctors and facilities, and the drug formulary and more. Now, if you're unhappy with your plan's changes, you can switch to a new Medicare Advantage plan during annual election period, or AEP. Some people call it open enrollment. That's not actually the accurate name of it. It's annual election period. But it runs from October 15th to December 7th, and during this time, you can switch to any Medicare Advantage plan that's available in your area. Now, any plan changes that you make during annual election period will take effect on January 1st of the following year. So if you're unhappy, make sure that you enroll before December 7th. Otherwise, your current plan will automatically renew for the next year. Now, if you're losing coverage because your plan is closing in 2024, you technically have until February 28th to switch to a new Medicare Advantage plan. This is because you qualify for a special enrollment period that runs from December 8th after AEP ends and goes all the way to the end of February. But be careful, because if you're losing your plan and it's not going to be available in 2025, if you enroll in December, you'll have a plan on January 1st, but if you enroll in January, you won't have a plan until February 1st, and if you enroll in February, you won't have a plan until March 1st. So we don't want you to have an interruption in your coverage. If you want to learn more about this and about plans going away and some of the changes and what to do if you're in that situation, I made a video about why Medicare Advantage plans are closing and a complete step-by-step guide on what you should do if your plan is going away. You can check that out over here, and I'll leave a link in the description below as well. Now, if you're in a situation like this and you need help searching for a new plan, you can get help from a licensed insurance agent at no cost to you. Taking it one step further, our agents here at PlanFit are paid by salary, so they are completely unbiased when it comes to helping you choose a plan that best fits your need. So if you need help, don't hesitate to call or text our team of licensed insurance agents here at PlanFit at 1-877-360-6565. Again, all of our services do not cost you and will not change the cost of your insurance. Okay, now that you know what's going on with Medicare Advantage plans, let's move on and take a look at what's happening with Medicare Part D prescription drug plans. This is another part of Medicare that's going through a huge shakeup in 2025. There are more changes to Medicare Part D in 2025 than we've seen in any previous year. And these changes are primarily due to the Inflation Reduction Act, which passed in 2022, but will fully take effect in 2025. The first change to Medicare Part D in 2025 that you need to know about is that the donut hole is completely going away. Now, let's start by looking at the stages for Medicare Part D in 2024. As you can see, there's a deductible stage where you pay 100% of the cost. There's the initial coverage stage, where you have copays that depend on the tier that your drug falls into. Then there's the donut hole where you pay 25% of the drug cost regardless of which tier your drugs fall into. And finally, there's the catastrophic stage where you no longer have to pay for your drugs covered in your plan formulary. In 2024, the average that someone would spend out of pocket before reaching the catastrophic stage was roughly $3,300. Remember this because in 2025, it's actually going way down. Now here's a look at the Medicare Part D drug stages in 2025. As you can see, the deductible stage is still here. The initial coverage stage is still here. However, the donut hole is completely gone. And in 2025, once you spend $2,000 out of pocket, you move into catastrophic coverage and you're essentially done paying for drugs for the rest of the year. Now on paper, these changes sound great. No more donut hole. Lower maximum out-of-pocket cost. What's not to love? Well, because of the lower out-of-pocket cost, a lot of the insurance companies that have prescription drug plans are either raising their premiums or removing some meds from their formulary or raising some of their cost share. That's again why it's critical to review your plan's annual notice of change or ANOC, and if you're not careful, your drugs might be removed from your plan's formulary without you even realizing it, and then next year you'll be shocked when you realize that your plan is no longer paying for your meds. Just like with Medicare Advantage plans, you can switch to a different Medicare Part D prescription drug plan during annual enrollment period, which runs from October 15th to December 7th. And again, if you need help from a licensed insurance agent, call or text us at 877-360-6565, and we'll help you out at no cost to you. Now, last but not least, let's look at the changes to Social Security. Every year, Social Security benefits go up or down depending on inflation, and this is known as the Social Security Cost of Living Adjustment, or COLA. So let's have a look at COLA numbers for 2025. In 2024, there was a 3.2% COLA increase across the board. Now, everybody gets a different amount from Social Security depending on how much they paid into Social Security and how much their income was when they were working. However, in 2024, the average benefit for people taking Social Security at full retirement age was $1,927. Next year, things are going to get a little bump. A few weeks ago, Social Security announced that there's going to be a 2.5% COLA increase in 2025. In practice, this means that most people are going to see about a $50 increase in their Social Security benefit. So instead of a $1,927 average benefit, it's expected that we'll have about a $1,977 average benefit in 2025. And again, everybody gets a different amount, but don't you guys think this increase is a little small considering how much inflation we've had? COLA is supposed to keep up with inflation, but if you look at the numbers, you'll find that the price of eggs has increased by 28% from last year. And if you look at this chart by CNBC, you'll see that a lot of these essential goods are up by more than 2.5%. I mean, dried beans are up 6.8%, beef roasts and butter up by 6.7%, pork chops up by 5%, ground beef 4.9%, tomatoes 3.9%, sugar 3.6%, and on and on. And look at some of the other things that you need to buy, like electricity, it's up by 3.9%. Everyone has to have that. Motor vehicle insurance, 16.5%. Banking services, 8.9%, and even care for elderly people at home is up by 7.4%. And remember, the base Medicare Part B premium is going up to $185 a month in 2025. So you can see that when you look at all these essential items going up by more than 2.5%, you begin to feel like COLA increase might be a bit too low for most people. And then the other factor is that when Social Security increases, like they did by $50, but Medicare has all these increasing costs, it's like the money is going from one hand to the other. What Social Security gives, Medicare takes away. And Medicare may not take all of it away, but it certainly takes a portion of it away. But what do you guys think of all of this? Do you think the Medicare increases are too much? Do you think the COLA increase is too little? Let me know in the comments below. Now, there are a few other changes to Social Security that you need to know about, such as changes to the maximum Social Security benefit, changes to the maximum taxable income, and changes to the earnings test. Now, if you want to learn more about these changes and all the details around what's happening with Social Security, go and check out my other video, which goes over all of these changes in detail right here. Other than that, thank you for watching, and I'll leave a link to the video that you should watch next.